The COVID-19 pandemic has caused plenty of havoc nationwide, but one of the little-known side effects is hair loss. Dr. Craig Ziering is here with more. Thank you so much for being with us.
Hi, how are you doing?
I'm doing well, thank you. So, hair loss after COVID, it's something that we have not heard much about, but how common is it actually?
So it's extremely common. It's actually in the top 20 of symptoms that people are experiencing with COVID-19. It's actually more prevalent than a rapid heart rate, than nausea, vomiting, even a sore throat. And 2 out of 5 people are experiencing stress-related hair loss as a result of COVID-19 or the quarantine pandemic.
And who may be more likely to experience hair loss?
It's really not discriminatory. It affects men and women and all sexes and all patients from all walks of life and any ethnicity.
Is it treatable?
Absolutely. So the telogen effluvium, which is the most common cause related to the COVID, it's a shedding of hair. And you don't lose all your hair, and it can be restored. There are many things that we can do. Just breaking that stress cycle is the key to this whole thing. And you can do that through meditation, through exercise, through actually learning something new, anything that reverses the imbalance that's occurring with the hormones. And then there's medical intervention. At Ziering Medical, we have topical medications that we can use. We have laser therapy. There's injectable stem cell growth factors. And if it unmasks an underlying pattern hair loss, we can do surgical restoration.
And is postpartum hair loss similar to COVID hair loss?
It's very similar. It's the same thing. After postpartum, telogen effluvium is the same occurrence. It's that stressor on the body, whether it be psychological or physical, and that's what occurs. And you can lose clumps of hair, but you won't lose all of it, so you'll get your hair back.
Are there any lifestyle changes that people can make to avoid hair loss?
Well, the big ones are just trying to take back control and break that cycle. So if you eat healthy, you exercise, take some vitamins that are good for the hair, skin, and nails, these are all things that will be beneficial.
And where can we go to learn more information?
Go to ZieringMedical.com and we can answer all questions related to hair.